speaker is Dr. Camilo Cava with the title of the presentation, Ultrasound Made Simple, How to Diagnose Abdominal and Thoracic Diseases with the Transrectal Probe, the Bovine Abdominal Thoracical Ultrasound, vale, by Colombia.
Hey, hi everybody, I'm very happy to see a lot of people right here, and I hope this presentation will be very useful for you in the future when you will in front of a cab. So it's an honor for me to present to you the summary of my professional life and how I have been using the transrectal linear probe to diagnose hidden diseases in cows. The name of this presentation will be How to Diagnose Abdominal and Thoracic Diseases with a Transrectal Probe, the BovATUS method. First of all, let's travel from my little town located in the center of Colombia. Colombia is in the north of South America, to here, Cancun, in Mexico. Colombia is a country with beautiful landscapes and obviously very nice cows. Our milk production systems is based on pastures. Let's start. Maybe you can recognize this type of call when a client asks you, in my case, Dr. Camilo, could you help me? I think my cow is sick. Okay, what's happening? You answer. I'm not sure. She just looks sad, just not normal. And especially with the phrase, should you look sad, is when our minds get shocked. And all the information looking for the answer because we want to help our client and obviously the animal, we may follow these 4 steps. Ask again, trying to find more information. Ask for the history. And ask again and again, trying to find forbidden or hidden data. But after finish the 3rd step, we don't find the answer. So we may follow to the last step, that is go to the farm and drive for 2 hours. Once we arrive at the farm, we observe the cow. We do the classical clinical exam veterinarian has. And after spending 10 to 15 minutes, we don't find anything striking. And immediately the client asks you, okay doctor, what do you think? And you answer, your low body condition score, anything relevant? And again, with a nervous smile, you answer, everything looks normal, but the cow is still sick. And at that precise moment, you remember and you ask yourself that, and you make a question to yourself, and if I could see inside the cow, and you remember that you have in your machine, that you have in your drug a machine that you use daily on reproduction, and you wonder if that machine, if you can use it to diagnose other diseases in other organs, and you realize that there are other vets, especially with other species and also humans, who utilize that diagnostic method. So you said to yourself, you answered, okay, let's do this. But before everything, we have to ask ourselves these 3 questions. Why to utilize this type of exam? What to scan and how to perform the technique? To answer the why is because the first, you can't find the cause of the disease. After doing the clinical exam, you can't find it. You have the machine, obviously. You want to be a better doctor. Repro is not everything in our lives. You want to help the animal and the farmer. You understand the business, how the business is running. You want to have the farmer's trust. That is the most important thing in our career. What to scan? I'm showing to you a list of organs that you can scan with that type of probe, and even more. Basically, all that moves. How to perform the scan, the technique. So there are some books that show you the technique and how it's done. The first two books that I'm showing right here are the veterinary clinics of North America of 2009 and 2016 that I strongly recommend. The third book is the Dr. Businski's book that I, again, strongly recommend to you because it has beautiful pictures, beautiful representations. And the last book is a repro book, the Ruminant and Camelid Reproductive Ultrasonography, written by Dr. Coloton and Dr. Ginemi as co-authors. And it's a beautiful book because it has the basics of the ultrasound understandings that will be very useful to know what is happening into the cow. But now I'm going to show you very briefly, obviously, because we don't have too much time, the method that I developed for the last 14 years, the BovATUS method. We can use the linear transrectal probe that we think is only useful to scan a pair of ovaries and one uterus. You don't need to buy a new machine. Let's see how we do this thing. So the method has an order. We are going to start from the left side and after that going to the right side. Why we decided to start in the left side? Because in the left side is the rumen occupying the majority of the abdomen, so few organs will be scanned right there. The scan will be very quick. And why to start in the thorax? Because pneumonia is the most prevalent disease in my private practice in adult dairy cows. So the order is thorax, reticulum, rumen, abomination region. And in the right side, we're spending more time to take more details. Again, the thorax, the pylorus abomination region, the small and large intestine, the liver, and finally the right kidney. But first, we have to know that we have to adjust three basic settings. The gain, increase the gain as much as possible, but without damaging the image quality. That's very important. Depth, set the maximum depth available. To imagine that normally for those transrectal probes is 12 centimeters. And frequency, set the lowest of the thorax of an adult cow. And you have to remember, because the longest you will there, you are not going to see the lump parenchyma. So reverberation artifact that this repetition of lines we'll see in a healthy lung. This white line is the visceral pleura that should slide smoothly. And this is how the scan is done. So apply the alcohol. My recommendation is always put the tip of the probe facing dorsally. The intercostal spaces from cranial to caudal and from dorsal to ventral. Watch my hands movement. This is how we done in adult dairy cows. If you want to scan the cranial part of the thorax, that usually is difficult, you have to obviously apply the alcohol right there and put a lot of pressure, as much as you can, to watch the cranial part of the thorax. The most important and normal findings, and obviously there are a lot of more, are lung consolidations, acute respiratory distress syndrome, and pleural effusions that is very related in the place where I live in high the mountains with heart diseases. That's very common. The second region that is very important is the reticular rumen abomination region. 30% of the time when you scan this place, you are going to see the reticulum rumen junction. The other time you are going to see the abomination with the reticulum or the rumen. You have to stop there and watch for the contractions. That should be obviously bimodal, as you know. You have to remember again that because those organs are filled with gas and content, you are going to see just the border of the organ. Sometimes the omentum come into the picture. You don't want to be confused with fibrin. Take care, be careful. And this is how the scan is done. So this is the place where you have to put the probe. One recommendation, there are a lot of cows who are very nervous when you touch them right there. The recommendation is, because you don't want to make it, is set the sprayer in the street mode, apply some alcohol just to warm the cow. The other recommendation is put the tip of the probe facing internally. You will always see the reticulum that should be pointing in the same place. The most important abnormal finding in that part is the hardware disease. So you'll see fibrin, fluid, and sometimes you will see abscesses. Going to the right side, we are not going to repeat again the thorax. So we are going to go to the second place, that is the pylorus and the abomination region. So the pylorus, you can see the pylorus in the right and in the left. The pylorus, you will see half moon shape with shadow artifacts due to the thick muscle that it has. It's very mobile, so you have to look for it in this place. The abomination is different from the other pre-stomachs because you will see the echogenic content, and you will see thin wall and thin folds. And this is how the scan is done, the place where you have to put your probe. So be careful, because some cows again are very nervous when you touch them right there. This is the pylorus, you have to look for it. In this place, we found the pylorus in that place. The most important abnormal finding in that place is obviously the displaced abomination that could be to the right or to the left. You know that this disease is very easy to diagnose with an stethoscope, but sometimes, especially in the right side, some doubts exist. So to clarify that the diagnosis of the organ who is causing the ping sound, you can put your probe right there, and if you see the content and the folds, you will confirm your diagnosis. Another pathology that you will see there is the abomination lymphoma, that you will see very thick walls. Going to the small intestine, you're gonna see the small intestine in these blue regions, but these three red circles or spots is the most the lesions in that region. So you will see cross sections, angle edges, cross section loops, angle edges, content from edge to edge, and constantly contractions. And this is how the scan is done. Again, apply the alcohol and watch and put the probe in those three regions. You will see something very similar to this in a healthy dairy cow. The most important abnormal finding in the small intestine is the small intestine accidents. So you'll see, you'll see increase in loops or bowel diameter a lot. You will see fluid between the loops. Another thing that is very common to see is decreased or absent contraction. You can see that the content is moving, but the intestine is not contracting. Going to the liver, you will scan the liver in the last intercostal spaces. So you have to be careful, because there is a part of the liver that is very chronic. You don't want to be confused with lung consolidation. So the liver is a very homogeneous organ. It's gray. That has a lot of vessels. Usually you will see the portal vein in number 1. You won't be able to see the caudal vena cava because that probe doesn't allow us to go very deep, and the gallbladder is in number 2. And this is how the scan is done. In this moment, we are going to increase the gain to its maximum allowed by the machine, because we want to improve the image of the deeper zone, because this organ is very big. So apply the alcohol right there. This is the condition how we work right there. And you will see the liver with its vessel. This vessel is a portal vein, and you have to remember that portal vessels has echogenic walls. The most important abnormal findings in that organ is are, the diffuse hepatic disease that is very related with nutritional poisoning that is very important in our place. Liver abscesses, there are a lot of sizes and amounts of liver abscesses. Fasciola hepatica, you will find sometimes, that is this case, you find a cyst with the liver or the fluid floating right there. Finally, we are going to speak about the right kidney. So this is the landmark of the right kidney. So it will be almost impossible to see the right kidney in just one picture. You have to move your probe to scan the whole kidney. The left kidney should be scanned via transrectally because it's in the middle of the body of the cow. And this is the place where you are going to see the right kidney. Sometimes it's really uncomfortable to put the probe right there. So you have to adjust and make it easy. The most important or normal finding in the kidney are incidental findings, at least in my experience. So you will see renal cysts that could be single or multiple, like this case. And I show you, this is not a percutaneous ultrasonography, it's a transrectal ultrasonography that is very common in the place where I live. Find cows as red urine, and you will find bladder neoplasm. As final consideration, you have to remember that fat cows, because the thick of the wall and the fat will cause you a lot of difficulties. So you cannot grade to watch the organs. You cannot grade the isopropylic alcohol to 100%. It will improve the image quality, but it will be not perfect. Be very careful with nervous cows. You can sedate them with xylazine, but you have to know that you will alter the small intestine because you will cause ileus. Protect your machine. In BRD cases, outbreaks, analyze all the data, not just the ultrasound data. Ultrasound artifacts tell you a lot. If you don't have the knowledge to analyze that information, I recommend to you to study it before. Try to find the same lesion in different positions. Sometimes you find something that it appears not normal, so just you prove, and if you find nothing, it may be real. Always make a relation between the clinical exam and the findings. This is very important because the relationship between the findings and the cow, the clinical exam. And obviously take your time, especially when you are at the beginning. As a take-home message, ultrasonography is a tool that you can use, but it's not today is Sunday, there is no live, you are very, very far away. You have to go to the farm, and you have to answer the question of the cow itself. You have to, especially in the countries where we live, where the farmers are very small. You will make a better prognosis. Time you can perform a complete thorax and abdominal exam in an adult dairy cow in less than 9 minutes. Finally, I want to say thank you to my dad Rafael, my sister Margarita, and my mom Lucero, my beloved wife Claudia, the future, I think, veterinarian, my daughter Maria Jose, and obviously to my teachers. From left to the right, Dr. Dr. Kuczynski, Dr. Nemi, Dr. Coloton, and Dr. Olivet, and obviously to my clients and their cows who allowed me to develop this method the last years. And I have to say gracias, and I will be more than happy to answer any question. I think that I have 30 seconds.
Thank you very much. We have time just for one very short question and very short answer.